If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got two really cool guests with us. We got Dr. Danielle and Dr. Joey with us from Wellness First in Juno Beach. So thank you guys for coming on. I know y'all are busy professionals seeing patients and stuff, but thanks for coming in.
Thank you for
Nice
having
to
us.
be here. Yes, thank you.
So tell us more about Wellness First and where y'all are located and what y'all do.
Wellness First is located in Juno Beach, like you said, and we are a concierge integrative primary care practice. And that's a mouthful, but really what we're just trying to do is to create an opportunity to spend more time with our patients. We see primary care as a great ability to treat the whole individual. And so it's Joey, myself, and there are two other providers there who are also osteopaths. Joey's a naturopath, and there are three osteopaths there. And I like to just tell our patients that, or people that are considering our practice, that we're doctors that think differently than I think conventional medicine or conventional specialist. We're really committed to finding the why behind why patients aren't at their optimal health.
Yeah.
And so I think the four of us really all are very committed to that answer, to finding the why. And it's cool because we all kind of have our own individual interest and niches that really, I think, work well together to really care for patients from a very comprehensive standpoint.
Yeah. And Joey, when did you get on board with them?
I got on board just over 3 years ago now,
Oh,
so
nice.
about 3.5 years ago.
That's
Yeah.
cool. And as a naturopathic doctor, right? The lens, like what makes you all unique? You said like we look at the patient differently, especially from your end, right?
Yeah.
What does that look like?
Well, specifically in naturopathic medicine, we're really trained to find the root cause. So we're not a systems-based approach. And I work with 3 other providers that also believe in the same
Yeah.
outlook. So what's really cool about us too is that we connect, and a lot of spaces don't do that. You have your patients and you work with those patients. We know our different strengths and specialties, and we all get together. And if there's a patient that's having some really difficult times, we'll get together and give all 4 insights onto it.
Yeah. So collaborating over.
We collaborate all the time. And it's really unique. I learn something every day from my coworkers, and hopefully I can contribute to their plans as well. So specifically with naturopathic medicine, we really do no harm, and we look for the root cause. So we dig deeper. It doesn't matter to me what you've been diagnosed with necessarily. It's a systems-based approach.
Yeah.
Of course, if there's inflammation, you can throw medications at it, but I want to know what's causing the inflammation, what's deeper than that. We find out it could be something when you were 7 years old that happened to you, and we will find it and we will address that. And oftentimes that's like the first layer of the onion that just starts to unravel everything.
Like what? Like what's something that could happen like at 7 years old or like 10 years old that could send a cascade of events?
So typically what I do see a lot is a lot like over antibiotic use, to be honest, in childhood.
Interesting.
That causes a lot of gut issues. It causes a lot of immune imbalances. And so we see just chronic gut issues that these patients have been given, Miralax or Xlax their whole life rather than really figuring out what's going on there and restoring the gut health.
Interesting. What I've heard with that too is like medications can trigger underlying genetic predispositions
Mm-hmm.
that then are expressed, and then down the road from that point forward, just a cascade of of events that happen, and symptoms then will progress. So in their 30s, and it's like they're feeling way different.
Yeah, our epigenetics, right? So we turn those off and on what we do every day. Environmental toxins and exposures too. So where you grow up, the stress you grew up around, and absolutely medications and overuse could be
Yeah.
part of that.
We'll get into this. Like I'm a natural hobbyist, I think, with pain science and just stress, anxiety, and home environments and stuff. We'll get into that later. I think it's just super interesting, but how it affects like the mind body connection and stuff. So and with something that I've heard with a patient recently, that a couple of patients actually, like a handful of patients, where they've had like chronic joint pain, hypermobility issues. Nothing's really helping. They're very sensitive with like exercise and movement and stuff. But they were described like a chronic Lyme disease in the past, which that's been not widely recognized from my understanding in the medical space. Is that correct? But explain chronic Lyme disease.
Yeah.
She'll nerd out on that.
Yeah. Chronic Lyme is just so underdiagnosed, and it is definitely getting, its heyday now. It's being recognized more, but it used to be, and there are still many practitioners that think you get a Lyme bite, you treat it with Oxy for 10 days and you're off on your own. And these patients just have this cascade of illnesses that happen after that. And what we are finding too is that maybe you did okay when you were 20 and you got bit by Lyme, you did some antibiotics to prevent major growth. And then all of a sudden you're 55 and you got COVID, or you were unwell, or you maybe got rebit, whatever it may be. And your immune system is just so worked up and inflammatory. And we're really looking and seeing a lot of these biotoxin illnesses. So the Lyme offsets a bunch of other conditions in the body and a chronic state of inflammation. So yeah, it's something that we treat a lot at Wellness First. And it's
So chronic Lyme would still be originally from like a tick bite. Okay.
Yeah.
And it just prolongs and lingers and
It
proliferates.
prolongs. Yep. It prolongs, lingers. It can grow. It can stay in what they call a persister phase, where it's just like it hides from antibiotics too. So you have to get really creative. There's really cool testing now, which I could really go down a rabbit hole with you if you wanted to, but you can actually see it, on blood smears now. Testing used to be, that was kind of what made Lyme very difficult. We didn't have great tests for it. So it was extremely underdiagnosed. Even though we were seeing 20-year-old women with debilitating symptoms and they were being told it was all in their head.
Yeah.
And I had a friend that it happened to.
Yeah. I mean, like, that's a classic story I've heard.
Yeah.
Where it's like, everything's coming back negative.
Mm-hmm.
We don't see anything.
Yeah.
Maybe consider seeing a psychologist.
Yeah.
Where it's, what do we, what do you do?
Yeah.
So anyway, the testing now is getting more exposure.
Oh, yeah. And even in terms of the testing for identification has been great over the last few years, but even in terms of confirming eradication, because now we know we need to make sure it's actually gone.
Yeah. So then what does the treatment look like? Like, what do y'all do?
Oh, treatment really is customized depending on the person. Antibiotics are definitely a part of the protocol. So we do usually combined antibiotic therapy, depending if they have a co-infection called Babesia, you're going to use a different anti-parasitic medication as well. But we really believe that the long haul treatment system incorporates botanicals. So we're looking at liposomal, cinnamon, oregano, those kind of things. Working with the immune system, we utilize ozone therapy a lot. Dr. D brought in ozone therapy, about 4 or 5 years ago now to Wellness First. And it works really great with chronic conditions like Lyme, mold, multiple sclerosis, things like that. So we combine a lot of different therapies for it.
Gotcha.
Yeah.
Explain ozone therapy.
Ozone therapy is using oxygen to heal the body. And so we use a generator because ozone is 3 oxygen molecules. And so it's a very unstable molecule. And so it doesn't occur naturally. You have to actually force those 3 molecules together. But depending upon what you're doing, giving in the blood, injecting it into a joint, inflating the bowel, or insufflating the bowel, it definitely has multiple different mechanisms of action in the body. And so if you're trying to address something like chronic Lyme, MS, it has a really potent anti-inflammatory activation where you're actually stimulating that NADH kind of redox reaction where you're supporting mitochondrial health, ATP production. And so we also see it really helpful in like chronic fatigue states, fibromyalgia, chronic pain states. We're injecting it into joints where it forms something called lipoperoxide, so stimulating the body's own natural healing response.
Yeah.
So working very similarly to how like stem cells or PRP kind of triggers this like non-traumatic injury to tell the body, hey, this, it's a regenerative kind of treatment.
Yeah.
It's also a sterile molecule. And so it does have this kind of anti or pathogenic kind of activity where it's going to help clean up if there's virus, parasite, bacterial invading agent.
They're
And
like
so,
lingering in the bloodstream.
or just in a joint even.
Yeah.
It's really, or in the gut. Like it's not a panacea. Like you can't just have ozone and not eat well or not move your body or have other things that your body's up against and think it's going to just cure all. But it
Yeah.
definitely has a really, really effective healing response
Yeah.
to the
Yeah.
body. Yeah.
Interesting. Um, so I imagine then like helping somebody with some kind of chronic illness going on, you're going to ask, is there a way to figure out with environmental toxins too?
Yeah.
What I was going to say is like, there's a multifaceted approach. Let's give some ozone therapy, maybe some antibiotics if it's appropriate. Diet and exercise always going to be super helpful, of course.
Oh, yeah.
But yeah, so is there a way to test for environmental toxicity?
Yeah, we run it's called the total toxic burden test all the time. I feel like everyone should do that test as a marker, and you can choose how often after that you want to do it. But that checks for heavy metals, molds, and environmental toxins. And you can also do the add-on of organic acids, which kind of tells us how those toxins are affecting our methylation pathways. But yeah, we check for everything in that. So you can check for parabens, plastics, pesticides, and I have yet to have anybody come back with zero.
Like clean slate. Yeah.
Yeah. But sometimes people are surprised which ones are higher for them. They're going in thinking it's mold and it's actually environmental toxins. And it helps us figure out which pathway we want to go towards when we are detoxing your system.
Environmental toxins would be like mercury.
Those are
Like
heavy
metals.
Yeah.
Heavy metals.
Heavy metals.
Pesticides.
Yes.
What would it come up on pesticides?
What do you mean?
Like what would it be like what would be showed to be high? Would it be like
Oh, it breaks down every single different pesticide and herbicide. So like all those
Okay.
chemicals that you're going to see on the back, like glyphosates and every herbicide and pesticide we have here. And this is Palm Beach area is very beautiful aesthetically. And in the past, we've typically overused pesticides and herbicides, and same with farming. So we are catching those
interesting?
really high levels in patients.
So what do you do with that? Don't eat pesticides. Cool. Where do we go?
Well,
Yeah.
it's obviously an important piece is reducing your exposure. So a big thing would be choosing organic produce when possible, right?
Yeah.
We understand that, a lot of times that's limited or cost prohibitive for patients. But really, if you can buy local, there are some really great farmers markets that I think the farming is a little more mindful of those things.
Yeah.
And so we also recommend washing produce, especially with things that don't have a large peeling. Like we kind of follow like the clean 15, dirty dozen. Like the clean 15 are things that you don't totally need to purchase organic, but the dirty dozen, and that list kind of changes, but there are some that like you should always be choosing organic.
What would those be? The dirty dozen and the clean 15.
Okay, so like
I've never heard that before.
yeah, so
That's
like
cool.
a dirty dozen, like spinach, blueberries,
Strawberries are
tomatoes,
always on there.
strawberries, things that don't have a tough peeling, like avocado don't really necessarily need to be
Yeah.
organic.
Watermelon may not be either.
Yeah, because you're not going to eat the rind, right? Oranges, I would assume, probably is not going to be a dirty one.
I don't have them totally memorized. I always kind of reference them, but
Yeah.
the ones that I know that I'm always like, that needs to be organic. It's the tomatoes, berries, spinach. Do you remember any of the other ones?
I
about
know
potatoes?
corn would be
Oh.
potatoes. I would do organic. Yeah.
Well, that's a whole corn and soy. I would absolutely always need to be organic because high pesticide load.
Yeah,
really,
yeah.
really high.
Interesting.
The other thing is just helping the body naturally eliminate toxins, right? And so a major thing that we always recommend is sweating. Okay. So obviously exercise is
Yeah.
the best way to stimulate that. But then we also are big fans of sauna therapy and
Okay.
incorporating that. Sure.
Like infrared sauna?
Infrared sauna for sure. Yeah. And we utilize any kind of sweating. So luckily we're in Florida, so people can sweat pretty
Yeah,
easy.
just walk outside at 9 o'clock in the morning.
Exactly.
Yeah, exactly.
You're good.
Exactly.
Steam showers. I don't care how you do it. I don't care if it's one body part, if it's just your face today. Just open up those pores. It eliminates every toxin when you sweat.
Interesting. Yeah, that makes a lot of sense.
Yeah.
There's so many more benefits. Like exercise is great.
Yeah, and it
You know,
moves your
rationale.
lymph helps eliminate all of these. We also can see with that test, if you have extremely high levels, we're not going to scare you and you have to live in this bubble.
Yeah.
But if we see really high levels, that makes us think, are you having methylation issues in general? So we support the liver as well, to help. And we use binders to help kind of attach to the toxins and help excrete them even further.
Are there any supplements you guys recommend as like an antidote to these things?
Yeah.
Like turmeric, black pepper, ginger, creatine. Um, you know,
Specifically for toxins.
yeah,
Yeah. So I just mentioned the binder.
yeah,
That's a big one that we use for both molds and toxins. It helps to attach to them and carry them out. We love to support with glutathione and other liver supporters. So we work a lot with the liver and we open up, kidney, liver. We have to make sure you're having, like, I know it's not sexy to talk about, but a bowel movement every day. Because
yeah,
if you're
Day.
not,
Yeah.
then we're reabsorbing all those.
yeah, for sure.
Yeah.
Gotcha.
Yeah. When in doubt, make sure you're moving your bowels once or
Mhm.
twice a day. Like truly, I think even going once a day is probably not enough for
Mhm.
all the things that we not only consume in terms of our food, but just the other things that we're exposed to that
Yeah,
ultimately gets filtered and the gut has to, that's how you eliminate toxins, another major way.
yeah,
Mhm.
yeah. I gotcha. You were also mentioning testing is important and
Mhm.
like the full body CT scans and functional health, like extensive blood testing can bring up a lot of things.
Okay, there's multiple different ways of kind of the things that are kind of now in vogue are the full body CT or the full body MRI.
Yeah,
And that's whether that's necessary for you at this point in time, I think is a discussion that you should have with the provider that you trust because a lot of times we're finding things that we call incidentalomas, meaning they're never going to be clinically significant, but it's like, well, you have this information now, what do you do with it?
yeah,
And so, I think everything in medicine is risk reward. And so you kind of have to know, okay, if I find something, if it's in its early stages and you're seeing it, that's actually amazing. But
yeah,
if you're seeing something that's going to get you worked up and anxious about it and then pursue unnecessary testing beyond that,
yeah,
that's the downside to those
yeah, yeah.
things.
Like the net cost of like the anxiety and stress involved, other tests, other exposures to stuff
Yeah, sure.
because you found a benign thing. Yeah, that makes total sense. Um, and then with extensive blood work, same thing. Like full panel blood, because I have a patient that she's a doc locally, like full on insurance hospital. You know what I mean? So she's super overwhelmed.
Mm.
But she has she's like, I have a closed, very small lane of like what I do. And this patients will come in and be like, I want like a full blood panel, full blood work. She's like, I don't know what I would do with that anyway, because I can't prescribe stuff, and
Mhm.
I'm so overwhelmed. I can't do anything with that, But anyway, I think it's super helpful, right, to get a wide panel of stuff. But is it similar though if you get like all the time and too much? It's like a lot of neuroticism and anxiety over certain levels not being perfect, or the more information, the better.
So I would say there's a lot of markers that we do really nerd out on and think are hugely beneficial. And there's longevity ones now that can tell you your organ age, and
Yeah,
it tells you, am I taking the right supplements? Am I doing the right things? Especially those of us that try to live a healthier lifestyle. Like, am I going down the right pathway or do I need more of this? But there is also oncology screening. And I would say that's along the same pathway as the full body MRI. So those ones, it's do you want to know? But they can identify based on your blood cancers really early. But there is a slight chance of false negative on those. So I
yeah,
would say those fall into that same category.
yeah,
But I really like the biomarkers we use in blood work.
Oh, I think blood work is a different story.
Yeah.
I
yeah,
think where we just want to caution people is if they are pursuing like a function health, like have someone that is going to sit down and know you and
Mhm.
know what that means specifically for you. So just having blood work without like a context of who you're treating, I think that can get into, I don't know, that can, you gotta have to
yeah.
know the patient,
It's not
right?
black and white.
Yeah,
Yeah.
because you gotta know where you're gonna start. Like if you see 12 things, but you have no context of the patient or their habits or what they're ready for.
Yeah,
And it's really hard to guide like where you start,
yeah.
or how you really best help them.
I feel
So
like I would put that in the same category as like imaging. for like spine imaging,
Yeah.
all the
Oh,
joints.
sure.
Because there's plenty of people that have a ton of abnormalities found, herniated discs
Yeah.
and facet arthropathy, degenerative changes, rotator cuff tears, bone spurs. But you can't look at an image without knowing somebody, and then identically next to somebody else was a similar image. Like, okay, who's in pain?
Yeah.
Person A or person B? It's like, well, I would think they both would be. Well, actually, person B has no pain at all,
Exactly.
right? Like then the imaging doesn't always correlate or isn't diagnostic prognostic of like what they're going to be like, you know?
Yeah.
But anyway, what markers would you nerd out on that you love a lot?
So, I mean, we like obviously the regular panels and hormones. I mean, it can tell you so much. So now, we happen to have a lot of people right now in perimenopause, and that's a great, instead of just kind of being told these are the symptoms you have to deal with, we can look at those exact hormone levels and treat so specifically towards that. We do really like the True Age and True Diagnostics, where we can look at your biological age and some of your nutrient markers and inflammatory markers. Those are nice things to look at to see if you have elevated inflammatory markers. That's something that we know we want to bring down. We love looking at blood sugar, insulin. We want to make sure we feel like that value should be a lot lower than what most people target it at. So those are all ones that we feel can really impact longevity and overall health and prevention.
Cool.
One of my favorite tests that Joey recently introduced me to is something called the hormone zoomer. We use a lot of the Vibrant tests. And we were working with a young girl who is still menstruating, and really was cool to see how her hormones, she's not only producing them, but how they're being broken down in the body.
Yeah.
And then we get to see also, are there certain chemicals, environmental toxins that are then affecting how her hormone synthesis and how her hormones are being metabolized. And so it was like really eye-opening for her to be like, oh, so I'm not crazy. This is why I don't feel good. This is why I'm irritable. This is why my periods are kind of all over the place. And so that was really satisfying to kind of find. I mean, that's like the perfect test, right? That like really corroborates your patient's symptoms and their story. I find it really frustrating when a patient comes and they're like, well, all my lab tests have been normal, and my endocrinologist has said, well, your labs are great, and so sorry you don't feel good.
Yeah.
It must be in your head, or it must just
Yeah.
be an age thing. And it's like,
Can't do anything for you.
Yeah.
right. Or just keep taking your Synthroid, and sorry, I really, and that is, I don't mean to be
It's all right.
I don't mean to be critical, because
Yeah.
sometimes they are just up against a time
Yeah.
restriction.
Totally.
And that is why we just said, we're going to do it differently. We're going to spend the time that is needed, not only when the patient's in front of us, but Joey and I, there's a few patients that we're talking almost daily about,
Yeah.
because they need that kind of attention. They need that kind of brain power. And so that's
One thing that, I mean, like, one thing I like about you guys, because we refer a lot of people to you, and
yes,
then
thank you, Kyle.
something that we try to always emulate as well, like a core value, I feel like my practice, is just trying hard.
Yeah.
Like, let's dive into the matter. Where like this young girl, it's like, this feels weird though. Like I'm having these interesting symptoms. Can't really put my finger on it. All the tests are negative. All right, take Synthroid for the rest of your life. You're good. Can't do anything for you. But why though? Right? Like let's dive in and just like try hard.
Yeah.
If you just like happen to get, like if you're a guy calling it your insurance or getting like try to get a refund from like your airline or something like that, right? Like an airplane, and you just happen to get the one person that just like let me just look into it
Cares.
real quick.
Yeah.
Let me just try. And they figure it out, I'm like, that's a huge pet peeve of mine.
Yeah.
Or like the other person be like, nah, can't help you. Sorry. Seen it a million times. Don't know what to tell you. It's like,
Yeah.
you're just not trying.
No, we love the
Yeah.
challenge. Like
Yeah.
if you're like, no one has figured this out, we're like, okay.
Here we go.
challenge accepted.
Yeah.
Let's roll our sleeves up.
Yeah.
Right.
So, all right. So that young patient that you're describing, what do you do for that?
Oh, we did.
'Cause I mean, I would imagine like Synthroid for thyroid issues, right? Is there a pathway off of that?
Sure. You heal the gut, you fix
Micronutrients. Yeah.
micronutrients, you correct hormonal imbalances, you get them moving, you correct their gut. I mean, oh yeah, sure. I am never of the mind that if you're on a medication today, then you can't get off of it, in the future. I mean, I think that's always our goal, right? Is to get them off pharmaceuticals. We actually believe the body has an ability to heal itself, but you got to have the right tools. You got to be consistent with those things that aren't sexy, you know, going to bed at a
Mhm.
decent hour, like
Yeah.
moving your body every day, limiting your screen time, like choosing a chicken breast over the chicken nugget. Like it's things that, you know, it's just the daily.
Million little things,
Yes,
yeah.
yes, it
Yeah.
really
Yeah.
is that make a huge difference.
And you commented earlier about, diet and nutrition, what kind of role they're playing. And especially when we're looking at the hormones with a lot of these females too. And I had mentioned perimenopause, cortisol in
Mm.
today's day and
Yes.
age for female and males, they're just wreaking havoc on our systems. And they're such a big part of, weight gain and sluggishness. And it can be part of thyroid and all these other dysregulations in the body. And we're finding that on this test as well. And so that's something that I can give you a bunch of things that are going to reduce your cortisol, but it'd be even better if you went to bed at 10 every night, or you didn't fall asleep with your phone in your hand, or
Yeah. Yeah.
these little things make the biggest difference.
Yeah, yeah.
Yeah.
It's something I totally agree. Something I try to communicate to patients with like fixing their shoulder pain or the back pain or whatever. It's like there's no magical like exercise.
Mhm.
It's like 100 golden BBs that all add up and
Mhm.
end up tipping the scale over a couple weeks to where
Right.
it's like, hey, it's weird. I've spent all day today and like I haven't felt my back. Weird.
Mhm.
Like that's how it happens. It's not like a magical moment, or like
Mhm.
this one stretch, this one mobility thing like fixed it. Um, so you said micronutrients. What do you mean?
So when we look at thyroid in particular, we want to know, there's certain nutrients that help it, like selenium and iodine. And so you can start to just replace those and make sure that they're making their levels, or you can test for them. And we have testing for that as well. So you can test for micronutrients. Some people really want to see exactly, are my B vitamins off? I've been supplementing on this protocol for 5 years. Am I at those levels? So we can test for that. But typically with thyroid, we'll make sure that they're on certain nutrients like selenium, iodine potentially, B vitamins always. Yeah.
So have you guys had patients with hyperthyroidism or hypothyroidism? Hypothyroidism is you would take Synthroid. Is that correct?
Hmm.
Where they have been able to wean off of Synthroid and they're like steady.
Hmm. Yeah, hyper is a little definitely different story, but
Hyper is a different story,
mhm,
and but I have had success with significantly reducing the medication and then using other therapies like peptide therapy,
Mm-hmm.
and really something called low dose naltrexone, different immune regulators to really, I mean, so much of what I think we're up against in chronic illness is a dysregulated immune system. And so, sure, you want to address the Lyme, the mold, the environmental toxin, but you really want to support the immune system to then address it for you
Yeah.
because that's what it is designed to do. And so, whenever we're talking about a complex patient and like, where do you start? Supporting the immune system's own natural ability to fight that thing or to address that thing is always in the conversation. So I don't know if that answers your
No, that
question.
makes total sense. Supporting the immune system with the stuff you just mentioned, like supplements for B12, supplements for uh, the other stuff you were mentioning.
mhm,
Well, that's part of it, sure. But it's really, I mean, fixing the gut. I mean, that's gonna be a a big, big thing. Can't underestimate the power of your food and what you like fork to mouth.
Yeah, like constantly consuming.
Yes,
Yeah, yeah.
I tell a lot of my patients, like, you cannot outwork your fork. Like, people just
mhm.
wanna kinda overexercise to death or oversupplement to death or, you know, overpeptide or hormone to death, and it's like, the food is really I think sleep and food are king and queen
Mhm.
in my mind.
Yeah, and I'd throw stress in there too.
Sure, but that I think sleep is a major way that we, uh,
Can help that.
yeah,
Yeah, yeah, that makes
reduce our
sense.
stress and
Mhm,
help the body heal from
I
stress.
was talking to a patient this morning. They were just like telling me that they recently had been waking up at like 3 o'clock,
mhm,
can't go back to sleep. And they're like, when do you sleep? And I'm like, I usually get to bed like I've been at like averaging 7.5 hours, which is not enough.
mhm,
And they're like, how do you do that with 3 kids? And it's like, well, I wake up like every 3 hours, like it's super broken. And they're like, oh, so you're not getting 7.5 hours. And I'm like, no, I'm not. But I would go to bed. The time length is 7.5. I was like, I don't want to get one. I don't want to get one of those like Nova rings or whatever they're called, or new
Aura.
Aura
Yeah.
rings. Yeah, yeah. I don't want to get. Oh gosh,
Maneuver ring.
Yeah.
You can't have one of
Yeah.
those.
Yeah.
Sorry,
You don't
I'm,
have the right parts.
yeah, Aura ring. My bad.
That's
We
great.
could edit that out.
No,
Yeah.
you shouldn't. That's great.
Oh gosh. An Aura ring. Oh, God. Because I'm actually depressed. Like, I'll be like, I'm getting terrible sleep, you know?
Mm-hmm.
And not even, yeah. I actually just recently got my blood work done. I'll have to give it to you guys. I haven't got the results back yet, but see what y'all think. But had another patient that they're young and healthy female battling chronic shin pain
Mm.
that's been going on for a long time. X-rays are negative, MRI is negative. Like, of like maybe like, are you overtraining? Like, she's thin. I'm like, okay, you're running a lot, stress fractures, osteopenia, nutritional support, right? I was like the female athlete triad. You know what I mean? Great recipe for that. She's
Sure.
like, no, all that's good. She's not really even exercising that much. But anyway, the only thing, and she got blood work done. And when they really came back was like really high cortisol levels.
Mm.
Yeah. But anyway, so since then, she's still seeking treatment, you know? I was like, man, I'm doing from a musculoskeletal standpoint, I'm doing everything I can. That's why I referred out. I was like, let's get some blood work, you know? I sent her to you guys, but it's too far for you. She's down south a little bit. But anyway, yeah, other than that, like that's the only thing that really came back.
Yeah.
Everything else was kind of within the normal ranges. So it's been super interesting.
Yeah.
But you mentioned cortisol. I'm like, that has to play a role. Something is dysregulated.
Oh, sure.
That's cool that you're considering all that
Yeah.
with your patients though too, and you're referring out for further testing, and that's a piece of, you know, your treatment plan. That's really progressive.
Yeah, well, I appreciate that. No, but I was like, I want to do everything. My lane is neuromusculoskeletal pain, biomechanics, joint mobility, activation, like muscle strength, and then like mechanics with like running and squats and how this playing a role, chronically irritating something underneath, like the posterior tibialis or like
Yeah.
tibial, like the ankle joint, whatever. Um, but yeah, and anyway, like it wasn't working, you know.
Mhm.
She's like, it's a little bit better, but it's not. And I'm like, this should be clearing up.
Mm-hmm.
You know, we're doing everything, you know.
Well, what I will say,
But
just to the point about distance, Joey is doing a lot of our functional testing for our non-members. So you don't have to be a member of our practice to see one of us. Joey is really targeted to our integrative side, our integrative plus side,
yeah,
where we have integrative therapies like IV nutrient therapy, chelation, ozone, but she's also doing the majority of our functional testing for people that just want to know about their hormone zoomer or their cortisol levels or their toxic burden or their gut health. And she spends so much time with them. She does a beautiful job. And I really think worthwhile investment. We're also off getting those tests on our website. And so you can
Mm-hmm.
just go on the website, kind of get a quick rundown of the different tests that are offered and why someone might be interested in that testing. You can
yeah.
pay for that test right on the website, schedule a follow-up with Joey, really streamline. And so that shouldn't keep people from seeking this kind of, not just from us, but you know,
Everywhere.
anyone, but the testing is available.
No, that's good to know
Yeah.
because like the barrier to entry of like, well, I'm not a member. Like, how do I come in?
Yeah.
Right? Oh,
Sure.
well, you have to be a member in order to get services. And
Yeah.
that's great.
Yeah.
Because y'all can get testing and stuff, and then like at least meet y'all, and then get you on a path of like, if it's not with us, like here's what we think you should do.
Yeah.
Totally.
That's good. That's good to know.
Absolutely, yeah.
Tell us about so what are when people come to see you? Well, before this, actually, I wanted to ask you. So high cortisol levels.
Mm-hmm.
What do you do? Where do we go from there?
So everything we talked about with regular sleep times, going to bed, reducing stress, obviously little things like deep breathing, cold therapy can really help with it. Vagal exercise. So like humming, shock therapy, all that. And shock, I mean cold, like hot
Yeah.
cold.
Electrical
yeah.
shock therapy.
Yeah. Yeah.
You know those wires,
Come
like
to us. We're super gentle, no
Yeah.
harm.
just grab those wires
Yeah.
for like 5 seconds. Yeah.
Just jump in a pool,
Yeah.
wire in it. And then we do supplement too. So we support the adrenals for cortisol big time. So a lot of people, especially you've just come out of school, you have kids, you work like crazy, you travel a lot, whatever it might be. You've just finished an Ironman, your adrenals are shot. So even though you're doing this awesome thing for you, your adrenals are shot. You've just had a baby, for example. A lot of women postnatal are like that. So we supplement their adrenals, and some are in the morning, some are at night, and usually we do a combo of both. And it's usually a blend of botanicals, possibly like neurotransmitter support. And so we aid you into getting better sleep. We're not just like, I think the worst thing you can say to someone is like, work out more and go to sleep.
Yeah.
Like that's it.
Just sleep better.
Yeah, we
Like, problem
support you.
solved.
Yeah, yeah. We want you to get on a bit of a cycle so that your body knows what to do, but we get you there with the supplements and the botanicals, so that your body's in a better state to accept that. Magnesium's probably huge for you and really big for us in calming the nervous system, because we can say what we want, but you need help in shutting your mind off before you go to sleep. That's often what causes like a 3 a.m. wake up. It's not always that you can't fall asleep. It's your mind was racing and it wakes you up at 3 o'clock. Regulating blood sugar is also huge for controlling cortisol. So making sure you're having like protein and fat and fiber in your last meal, and it's not like an empty pasta dish, can really help your sleep as well.
Gotcha.
Yeah.
Yeah. I would imagine alcohol plays a role with that too.
Absolutely. Alcohol. And that's what when the Aura Ring is really cool. Some people notice, or there's other ways that you can track your sleep as well. But some people notice alcohol has the biggest impact on their sleep, and especially that 3 a.m. because alcohol does cause that blood sugar dip as well.
Yeah.
That causes you to wake up.
Interesting.
Yeah.
I was, you're going to say something?
Well, magnesium is one of, I think, the most important nutrients that we can take, but different magnesiums hit different systems.
Mhm.
And so I would say if you're looking to address the gut, it's magnesium citrate. If you're looking to address muscular tension, it's more magglycinate. If you're looking to hit the nervous system, it's going to be mag L-threonate.
Mhm.
And so it really, the type of magnesium you take really does matter. My current favorite sleep aid support is ashwagandha. I was having that 3 a.m. wake up like every night. I have a lot on my mind, right? Patients to think about, a business to run. And so it was suggested to do ashwagandha. And man, I take that thing at 8 o'clock and I am out. And it's beautiful. And so I don't, maybe
Are you
that's
tracking your
helpful.
sleep like quality and stuff?
I was with the Aura Ring. I've kind of since given up on that. Just there's so many things I'm tracking right now, so it's just one less thing. But yeah, ashwagandha at 8, in bed by 10, and I'm sleeping through the night. And sometimes I'll add a little magnesium, but you should be careful because magnesium can cause loose bowels, so too much can do that. So,
Mm.
anyways, don't mean to be TMI, but
Yeah, I've heard a good combination of magnesium, vitamin C, ascorbic acid, like supplement,
sure.
and potassium
Mhm.
all together. This could be helpful. Have y'all heard that before too? Like, does magnesium pair well with other supplements to like activate it better?
Oh, absolutely. I haven't heard of that trio specifically for sleep or just activating magnesium.
I think both. Sleep, um, stress, I guess, and then body recovery.
Oh,
Yeah.
interesting.
Like imagine some like training,
Yeah.
like intense workouts and training and running and doing all this stuff. Be just a supportive supplement stack to help with all that stuff together.
Okay, nice.
Cool. Yeah.
That's very cool.
But anyway, I'm not taking that. I was for a little bit, but
What do you take, Kyle?
yeah, good question. So I find myself I think I respond pretty well to creatine
Yeah.
Okay.
monohydrate. I'm talking about like for like working out,
Yeah,
right?
yeah,
Because
yeah.
I would only take something if that's what I'm taking for that for, like for exercise and supporting it as much as I can, right? But creatine, and then whey protein
Okay.
that has a branched chain amino acids in that with leucine, isoleucine, and valine.
Mhm.
Those are the main supportive ones for muscle growth. And then I was taking magnesium, potassium, and the ascorbic acid for a little bit, but I ended up stopping that. I don't think I really saw too huge of it,
Yeah.
but maybe I didn't take it long enough. I don't know, but I didn't see anything crazy. And then there was a time I've gotten off a little bit more, and I'll tell you why. But with turmeric
Mhm.
extract
Yeah.
powder
Yeah.
Sure.
with black pepper
Black pepper. Yeah.
and then ginger.
Okay.
Yeah.
So, but turmeric, man, like have you ever seen the extract powder?
Yeah.
Oh my
Sure.
gosh, it stains everything.
Yeah.
And it doesn't get absorbed by like liquid. So
Yeah.
you can't put it in your water and stir it up. It just still floats to the top.
Yeah.
It's so annoying.
Yeah.
So what I do is I just scoop it in dry
Yeah.
over my sink to make sure I don't spill.
Yeah.
You take curcumin dry.
Yeah.
Yeah.
Whoa.
Just like it's like a little bit.
Oh, okay.
Yeah.
And then and then a little bit of black pepper extract as well.
Nice.
Throw that in dry. Just put some water in, swish it around, swallow it, done and done. But anyway, there was one morning, it was like 5 a.m., right? I'm like kind of groggy and waking up. I'm getting everything ready. And I didn't know it, but like I guess when I was trying to put it in like, through a spoon right in my mouth, it's a little bit just trickled off and fell on the floor.
Stained forever.
I stepped on it and I was walking all over the kitchen, went to the bathroom,
Oh
came
no.
back, and I like saw these orange stains on the floor. I'm like, holy like shoot, like
Your wife's gonna kill you.
yeah. And then my kids were waking up. And it's like a lot earlier than it's supposed to be.
Yeah.
It's like 5:45, and I'm like, shoot, man.
Mhm.
Like, 'cause it's the worst. Like, you can't wipe it up, you know?
Those
Yeah.
Like, creatine's super easy to clean up, you know?
Yeah.
Like, it just wipes up, you know?
Yeah.
Oh my gosh. So she was up with the baby, or oh my gosh, I was like, I have to leave for work. I got a patient. I gotta leave. I'm so
Yeah,
sorry.
I'm leaving this with you.
I
Yeah.
spilled turmeric and it's all over the freaking kitchen and it's into the bathroom and
Yeah.
back up. I
I
was
think you
like,
guys have a meeting about this. I'm going to do it right before I leave, and then I'm going to have a meeting or a patient or something. So
Right.
you have to clean it
yeah,
up.
exactly right. It's like, you did that up. You timed that.
Yeah, exactly.
No, I swear. I was so mad at myself. I was
Yeah.
like, I can't believe I'm like a neat freak, you know,
Are
like
you?
I'm kind of
Oh.
OCD. I'm organized. Like things have to be, I feel like the less clutter, you know, I think
Mhm.
more clearly, you know.
Yeah.
And I'm like a list guy. I have like lists and like
Yeah.
Oh,
super
preach.
organized.
Yeah.
Yeah. Yeah. Okay. Good.
Tell them
I'm
my
not the
wife.
weird
Yeah.
one.
No, you're not.
No.
But yeah, so like, you know, messes and stuff like that. I'm like, it just adds things to the plate that I don't want to have to do, you know,
Yeah.
because other things are more important. But anyway, I felt really bad. So I put a pause on the turmeric and black pepper for now. I'm
Yeah.
trying to figure out
You
when
can
I have to,
capsule. You could do a capsule of
Yeah.
it, and they have black pepper in them.
yes, I
Mhm.
get the Costco ones, you know,
Okay.
huge, or the Qnol, you know, it's like turmeric, black
Mhm.
pepper, and ginger.
Mm-hmm.
But I'm like, but there's like the capsules are like plastic. I don't want to eat those. What are your
Yeah.
thoughts? What are your thoughts on those? That's what my rationale. My rationale for getting the pure extract, eating it dry, is because I don't want to have more the actual capsule.
Yeah. I know what you mean. Most of the capsules are they're obviously not plastic. They're made out of some of them are
Vegetable.
pork, some of them are vegetable. Yeah. So they degrade pretty easily. I do think about that though when we do protocols,
Yeah.
like how many, and that's why I enjoy mixing in powders. Of like I take my magnesium powder. Most people take the capsule to get a higher
Yeah.
dose. I would rather take 3 spoonfuls than 9 capsules for sure. So I do think
Yeah.
about that, especially if there's gut issues. But most of them in our stomach acid are pretty easy to break down.
Okay. All
Yeah.
right. Good to know.
Yeah.
So if you're like, all right, let's say a provider was like, we're gonna get you on 15 different
Well,
supplements,
that's a lot.
and there's a lot of capsules.
Mm-hmm.
You know what I mean? So you're pretty confident that wouldn't, just with the processing involved, the process to develop the capsule.
Not all capsules are made the same either. So if you go to your local CVS, they're not all made out of the same nutraceutical grade and third-party tested products that you would at a company like Zymogen or Thorne. So
Mhm.
I can't speak across the board for most of
Yeah,
them,
yeah.
but most of the supplements that we use and give are easy on the digestive
I'll have to
system.
investigate Qnol then, because that's the one that seems to be the best
Yeah.
bang for your buck at Costco, you know,
Okay.
or just
Yeah.
the Kirkland brand. I don't know.
Yeah.
Kirkland's, man, they're crushing it. Like Costco is like,
Yeah. There's no
they're
issues there.
super smart.
Mm-hmm.
A Thorn was the magnesium the stack I was taking.
Oh, nice.
Yeah.
Yeah. They're a good product.
They're good. Yeah, yeah. And recently the new creatine that I'm trying to get on is the German Korea Pure. If y'all heard of that, it's supposed to be the purest type. I haven't really had an issue, I don't think, but a patient recommended it. And I was like, all right, see, you know, if it's different.
Yeah.
But anyway, to answer your question, those are the supplements
Nice.
that I've been taking.
Yeah.
I usually creatine, I usually I think I react pretty well to that. Like I
Cool.
feel good,
Mm-hmm.
you know? Yeah. What do y'all take anything specific for yourselves? Because you were training pretty hard for that paddle
Yeah.
last year.
Don't crush my heart, Kyle.
Gosh, I know that was a hard,
Yeah.
Hard subject.
that was tough.
That's the sore step. No, I'm just
But let's okay, individuals like yourself training very hard.
sure.
Were you taking anything?
That was not that long ago.
Year
I,
ago.
a year
Yeah.
ago. I still train hard. It's just a different kind of training. I do like I like transparent. So if we're talking recovery activity, I have a pre-workout that I take from Transparent Labs. Um and then I take their same creatine supplement after working out. I also like the Perfect Aminos.
Mhm.
It just helps get a little more protein in me. It's really hard for me to get 120 grams. It's kind of where I try to live.
It is hard.
Mhm.
Yeah.
Like getting enough protein is hard.
Most people think, oh yeah, I get enough, and they're getting 60 grams, and you know that might be okay for some people. But if you're really like hitting the pavement hard with lifting, hit, I mean, most of the time people are over exercising, and I don't think their caloric intake from a protein standpoint is really,
Supporting enough for
yeah.
that. Yeah, totally. I got you. Let's talk about peptides.
Okay.
So I recently heard that the BPC 157 is illegal now in the FDA. Did you ever hear that?
No.
Doesn't surprise me.
Yeah.
But just with like, and that's where that's where the skepticism and cynicism comes in on my end of like, why? If it's who knows? But I'm like, I wonder if it's really effective in helping people
Yeah.
recover and do really well, if like other large business entities that are like, no, like people are getting too healthy. We need to like stop this so they're more on our drugs consistently. Anyway, that's just my conspiracy on that. But
Yeah, I mean, they've done this a bunch with the GLP-1s too that we know are effective. There's a whole conversation as to whether, you recommend them or not, but we know that they're effective at reducing weight and, you know, helping with some other biomarkers like blood sugar and stuff. But they keep taking it back on and off, and we know it's effective. We know there's very few side effects, and it still keeps happening. So I haven't heard that with the BPC 157. I've seen a ton of benefit in patients that take it, and it would be a great combo with what you do as well, both for gut and recovery.
yeah.
Post surgery, we use it.
So y'all incorporate that a lot
Mhm.
to practice.
We do, and BPC is one of the peptides that is available through the gut. So not all peptides can you ingest orally. A lot of them have to be subcutaneous.
Yeah.
BPC is one that is highly bioavailable through the gut, incredible for the gut. I actually have found that people that are taking it, it helps regulate that appetite control because it's actually healing the gut. A lot of times are those cravings is because you have an overabundance of yeast or parasites. Not that BPC is addressing parasites to my knowledge, but I do know that a lot of gut dysbiosis is what drives overeating.
Yeah, the cravings.
Absolutely.
Yeah.
So parasites play a role, yeast dysregulation plays a role.
Dysbiosis in general. So not
Right.
just yeast, overgrowth of any bacteria or.
Correct.
Interesting.
Correct.
All right.
So BPC is a great peptide.
So you recommend that orally, not injected.
I take it every day orally.
Oh, okay.
Injected.
Okay, it's not illegal orally. Subcutaneous, I think, is where the FDA hasn't approved it.
Well,
Or has disapproved
not
it.
approving and illegal or
They made it, the FDA cleared it to be not approved.
for subcutaneous use.
My understanding. Yeah. But orally is still okay.
It is showing incredible promise subcutaneously, like around a joint.
Yeah.
Right.
That's what I've been hearing.
Yeah.
Like knee pain, hip pain, back pain, like injected at the site.
Yes.
Yeah.
That's what's been, from my understanding, not cleared, but like disproved by the FDA. Like, no, y'all can't do this anymore.
Yeah.
That's a shame.
Yeah, it's a bummer.
Yeah.
But anyway, I'm like, why?
Yeah.
Well, it is something that you could learn because you do the dry needling, right? And so I think what dry needling is doing is something very similarly to what like prolozone or BPC is actually trying to do.
Yeah, I think it would be a great adjunct.
Yeah.
We need a lot.
Yeah.
Yeah. So yeah, what other peptides do y'all find yourselves prescribing?
So another one that I really like that's bioavailable orally is TB4 frag. Really great regulator of our Th1 immune system. And so a lot of times you need upregulation of that Th1 and a downregulation of something called Th2. That's a very rudimentary way of understanding the immune system.
Th1 and Th2. Educate people what that is.
Do you want to take that on?
No, you go ahead.
Well,
no, I don't.
Okay, so my very limited understanding, because the immune system is a complex thing, is that a lot of times when we see a dysregulated immune system, is we have a very dominant Th2 presence. Okay, and a very
T helper cells, right? Is that what you're saying?
Sure.
Yeah, yeah.
Yes.
Okay.
Part of that. Th1, Th2, Th17 regulator cells. So you want to support Th1 and you want to downregulate Th2.
Okay.
Okay. And TB4 frag can help upregulate Th1.
Okay.
Is one agent that can be done. And so I've seen it really helpful in patients who have autoimmunity issues, especially autoimmune thyroiditis, Hashimoto's.
Yeah.
And so
Interesting.
that's one that I've utilized as well orally. We're There are new peptides coming out all the time. A couple that we're really liking for other immune support is something called KPV. What's
Thymosin alpha is another one for immunity. KPV is a little more to like that mast cell activation, which when we talk about chronic disease, that can happen in any kind of chronic disease where they just are very inflamed. Everything they have is very inflamed. Whereas thymosin alpha is a little more general immunity, works with EBV, kind of those chronic conditions. The one I think is, Dee and I were talking the other day about a couple. MOTS-C isn't utilized a lot, but it's one that we're both like, I'll try that when it comes out.
I know.
They
I
call
want
it
to get them.
workout in a bottle.
Yeah.
What's that
Um,
one?
so it's like workout in a ball. It's called MOTS-C, and it's supposed to help maintain muscle function and metabolism. So totally different route than the GLP-1s. Like I just think that there's going to be so much more coming out that the GLP-1s are going to be old news, and especially for people that do work out and eat well. It's the big thing they're seeing with GLP-1s is there's just a massive muscle loss with them too. And I don't know if you've noticed that with your patients, but we see a decrease in muscle mass before we see it in fat mass.
Yep.
And then they get comfortable with that. So they kind of just keep going down that I'm eating the same things, just less of it. Whereas MOTS-C is thought to just enhance your workout. So they call it workout in a bottle. And it does help with insulin regulation as well, which I like again in these hormonal and perimenopause stages. Or you work a lot with ipsamorelin or like growth hormone secretagogues.
Tesamorelin, Samorelin. Ipamorelin is not readily available, I don't think, anymore. But yeah, if you're really looking to help aid recovery, it's acting on the pituitary gland to release growth hormone. So it's not actually giving growth hormone; it's stimulating the pituitary to release
do it
its own.
naturally.
Yeah.
Yeah. I got you. Because I know people have like their questions and concerns. There's like, what am I going to be on this forever? Then I'm going to dysregulate my hormonal system to then like have to be, dependent on this stuff. But you were saying, my understanding is that peptides, it stimulates the endogenous organs to do it themselves.
Correct. And we do cycle them. Like I don't ever say stay on this indefinitely. Like you either cycle it a few days a week and then you take a few weeks off, or if you're doing them like 6 days a week, then if you're doing it a couple months, you take a month off.
Yeah.
So yeah, you do cycle them. They're gonna work better that way.
Yeah.
And yeah.
I got you.
There's a copper peptide that's supposed to
Oh.
reduce wrinkles and
I didn't know about this.
skin health and hair growth.
Oh.
That's a big one.
Hold out on me on that one.
Oh, that's
What's that one called?
it's GHKU.
Oh, GHK.
Yeah,
Oh,
it's
okay.
copper peptide.
Okay.
Always writing that one down.
You don't have wrinkles, Kai.
Yeah.
No, yeah.
It's for a friend.
Yeah. That's cool. Well, that's interesting. What are your thoughts on semaglutide and tirzepatide?
Yeah, those are the GLP-1s.
Yeah.
I personally think that there's a space for them. I think that it's helped a lot of people get the motivation to improve their life. So they see the benefits and then they buy into it.
And the momentum rolls.
And they, in the meantime, are realizing, oh, I have less knee pain, or my back is hurting a little bit less, or I can now exercise more. At the beginning, I felt like it was just used as a crutch a lot. So it again, what Dr. D was saying earlier about who are you working with it? Are they focusing on the fact that it slows your motility? So is someone working on you about making sure that you're still having bowel movements? Because think about the long-term repercussions if we're slowing our gut motility. If they're not telling you to do resistance exercise at the same time and you're losing weight, but like 80% of it. I think they found that 80% was muscle mass if you weren't
Really?
doing enough resistance exercise with it or consuming enough protein, which would then make it so maybe all you're eating is almost protein, right? Because how are you going to get enough if your appetite's way down? So I see a ton of negative effects from it and things that you need to work on. So trust who you're working
Yeah.
with it, because there are a lot of things that you can just order it online now and be sent on your own, and you don't know about any of these things and the metabolic effects long term.
Interesting.
If you want to go off of it, your metabolism is just shot because now you have way less muscle.
And you're
Interesting.
primed and ready to store
Mm-hmm.
all that you just lost.
Yeah.
I mean, the body doesn't like to be in a state of caloric restriction.
Mm-hmm.
And so it's constantly, I mean, you take away that GLP and then those signals are just going to come right back. So it's just kind of like crash dieting, right? Like you can
Yeah.
only calorically restrict for so long and then your hormones are going to start saying like, feed me,
Yeah.
feed
What's
me,
going on
feed
here?
me,
Yeah.
feed
Yeah.
me, right? And so as soon as you take that away and you start eating normally again, you're going to store all that. And so it really does wreak havoc on the metabolism. I I'm with Joey. I think it has a space. I think like least effective dose, like lowest effective dose.
Yeah.
Um, and really being mindful of the other habits while you're doing it. I think it's the most important. Um, it also it has like I'm seeing it really help with other things like alcohol dependency.
Mm.
So it's helped people who were like constantly like thinking about alcohol or using that as another crutch, like they've been able to get off, like stop drinking essentially, which I
Cool.
think is wild,
Yeah.
right? They
That's
just
great.
like that just so there are some really other great benefits if you're not talking about muscle loss and things like that.
Yeah. Yeah.
And
Yeah.
part of the best thing and the hardest thing about functional medicine is we rely so much on you as a patient. You have to meet us somewhere or we
Yeah.
can only get so far. But there are patients that will only go so far. And so if you know that, and weight reduction no matter what is going to help all of their blood pressure and their inflammation and their blood, then it is a tool that can be used for that purpose as well.
Yeah. Yeah. Interesting. Last thing to bring up, you talk about stress and anxiety, right? And like the
Hmm.
psychology component of the mind body connection.
Hmm.
Do y'all, what route do you guys go with educating patients on that? Like, how do you dance around that component?
So I think we use a combination. So we do have the opportunity to spend a lot more time with our patients.
Yeah.
So we do have the conversations, and because we spend so much time with them, a lot comes out in our
Yeah.
visits. So we're a lot more
Same.
than if you're in a 5 to 10 minute session, right?
Yeah.
So it comes out. People want to talk, they want to share, and you know, w- that's part of our process. So getting them to talk, and meeting them and figuring out where their sources of stress might be. And we do utilize tests too to verify it as well, right? So we will check their cortisol to make sure, because some people think that they're so used to a high baseline level of stress. They're like, my stress is pretty good right now. But
Yeah.
like just being around them, you can feel the tension and the
Yeah.
stress. So it's kind of peeling back the layers and saying like, how much downtime do you have a day? What is your sleep like? Are you waking up? So a lot of it is our interview process.
Yeah, for sure. Yeah, because it's very similar, because I'm not a psychologist by any means, right? It's a hobby. I think it's just interesting stuff. You know what I
Mhm.
mean? About like to not leave any stones unturned, and like
Mhm.
all the golden BBs that add to the scale. Like when we can't neglect that stress and anxiety, like the psychological component of pain is a huge contributing factor, right? That's
Mhm.
what you usually suggest. Like the psychological component can't be not addressed. Like we have to consider that, and
Yeah.
we can't separate the mind from the body, no matter what we do. But it's interesting is like there's a lot more studies that are being exposed, I think, that aren't new, I feel like the immune I forget who the guy I just looked up a bunch of this guy's studies, but the connection with immune dysregulation,
Mhm.
dysfunction, and then the psychological stress anxiety component,
Yeah.
and how people are a lot more prone to getting sick if they have higher stress levels.
Yeah.
And then cortisol would be like one of the main things to identify that in a blood test.
Yeah.
Um, if y'all are familiar with Dr. Lisa Feldman, I think is her name, Fieldman, um, she's like a world-renowned neuroscientist, psychologist.
Mm-hmm.
Really interesting. I was listening to a podcast of her, and she just dropped like a 2-minute segment on pain science.
Mm-hmm.
And I was like, whoa, whoa, whoa. I had to rewind it, and
Mm-hmm.
I like wrote it down. Anyway, she was just describing how like um everything is interpreted from the brain, right? And it's like in a black box that only just receives signals. That's it. It has no other understanding other than what it's learned previously.
Mm-hmm.
So it attaches current signaling to previously understood experiences, and it associates that together, right? So I was like, oh, that makes total sense. So anyway, she was dropping bombs as in like really trauma and pain right now is sensory present with learned past.
Yeah.
So like a learned past with sensory present.
Interesting.
So yeah, right. So like it triggers certain reactions based on our previous experiences.
Mm-hmm.
Where even though from a pain science standpoint, even if there's not actual tissue damage happening,
Mm-hmm.
there can still be a pain cycle that's being experienced, right?
Oh yeah.
Right. I'm like, so anyway, how do you teach somebody, educate?
Well,
We try to be super delicate and like
Mm.
depending on their micro expressions in their face and like what they're reacting right then in the conversation, I'll like change
Yeah.
directions. You know what I mean?
Yeah.
But I'm sure you have conversation like that too. I'd assume with y'all patients, right?
well, to Joey's point, that is a delicate area, and it really does require having a rapport with the patient
Yeah.
and establishing trust. Because when you really start to get into some of the things that have caused them deep pain in their past, I mean, it's this, it's it needs to be tended to lightly and with care and
Right.
love, and we really can't just look at our patients as a physical entity. Testing
Right.
and blood tests and things of that nature. It's all very telling, but the patient's story, we cannot forget that, and the experiences that they've had to lead them to why they're sitting in front of us at any given day. And I've had multiple encounters with patients where they came with the physical complaint,
Yeah.
and you give them enough time and give them enough space to talk, and you listen, you be quiet, Dr. D, you don't say anything.
Yeah.
You really do then you're like, oh, this is a matter of the heart. This is an old wound, or this is a really deep wound.
Yeah.
And so actually you are having a physical manifestation of that pain, but this is really psychological pain.
Yeah.
This is a heart pain.
Yeah.
And so we're not therapists, but
Yeah.
I do think a lot of what we do is tending to that uh, emotional, spiritual being
Yeah.
that we all are.
Yeah. Yeah.
And if we feel like it's kind of out of our wheelhouse, then we have a network of providers that we trust, who then that is really where they're kind. I have multiple licensed therapists that I lean on, depending upon kind of who I think would be a good fit for that patient. There's also a brilliant guy, Mike Cohen, who that's all he does is brain work, and he really takes complex uh, uh, issues like PTSD and chronic depression and chronic pain, and he has his own way of doing brain mapping and then helping support that. And so, you know, we're never of the mind that we have all the tools, but we
Right.
do hope to then guide our patients into like who else can be on your team to really help support you in this
Yeah.
particular
Yeah.
area. Yeah.
For sure.
Have you heard of the book When the Body Says No?
I have heard of the book. I have not read it.
So it's remarkable. It's so much what you're saying. It was a cardiologist that his patients weren't getting better.
Yeah.
And yes, he was fixing them temporarily and they just weren't getting better. And he went deeper, like most of us that go towards, integrative. There's something that drove us there. So for him, he just kept finding patterns, and he could correlate certain conditions with past life events. And so he noticed, say patients with multiple sclerosis all had like a similar, situation in their marriage potentially, or these similar patterns in life that caused different conditions. And whether you fully buy into that or not, just the relation that there are these life events and there are these mind body connections that we know set off a cascade of
Yeah.
other events. So yeah, I agree with Dr. D. It's something that they have to trust you and you have to give them the space. And sometimes the space is just not talking.
Yeah, for sure. Um, I have heard of that book and that doc.
Mhm.
There was somebody brought it up to me where they were like, this person, I think it's the same person, correlates everything ailment wise now can be linked back to some kind of childhood
Mhm.
trauma or something.
Believe it.
Yeah. But anyway, of course, not everyone's gonna, buy into that.
Yeah.
But I'm like, I mean, it's been proven that psychological environments and stress and anxiety can manifest physical symptoms. Like that's
Yeah.
been proven fact.
Yeah.
So it can. It's like, which is just interesting. Like, but anyway, I think just from a full comprehensive approach like that, it's not to be um, not addressed in some fashion. You know what I mean?
Mhm.
But anyway, um,
That's
so
almost my favorite part of practicing medicine, if I'm being really honest,
yeah,
because I'm sure Joey agrees, like, we're not going to heal you. Like, the patient is going to heal themselves. We're just going to be a guide. Like, the patient is the hero of the story. They have everything they need within them to get better.
yeah,
Sure, they'll lean on us, and we're going to be their advocate and champion and coach, collaborator, friend, whatever.
yeah,
But, like, at the end of the day, like, they're going to heal themselves through self-discovery, through their willingness to like actually address matters of the heart and their mind and their body. And so I think that's the most rewarding is those kind of encounters when they kind of have that kind of revelatory breakthrough, like, oh, I'm not crazy, like there is a reason why I feel what I feel. It's like,
Mhm.
yes,
yeah, yeah,
yes,
yeah, totally.
yes,
They feel better just unfolding that.
yeah.
Yeah, that's cool. So you mentioned a great way for people to like get exposed to you guys if they need help would be you have tests that y'all do right online. Like the people they don't have to be members to like come in and get tests and stuff,
Correct.
right?
Yeah.
What's the best way for people to reach out to you guys?
Joey?
So I would say, obviously, you can call. I'm happy to do any kind of consultation if over the phone. If you have questions in terms of guiding, testing, or if you want to do consult, you can come to our office and do a tour, and get to meet some of the practitioners, or you can go to our website at wellnessfirstjunobeach.com.
Okay, gotcha. And then also real quick, what would you describe to be like your wheelhouse? Where it's like if this is you, this is where we roll up our sleeves, like this is what we do.
You're frustrated with the conventional approach to chronic disease and illness, and you are looking for better answers. You don't feel good. You're told multiple times that nothing is wrong. All your labs look good. Come to us. We will listen and we will do our very best for you. And if we don't know, we will put all of our heads together and find a solution or refer you, right? Like
Yeah.
I am not of the mind that I am the doctor for everyone, right? I don't think any of us feel that way,
Yeah.
but we are up for the challenge and we do think outside the box and we do lean on pioneers in functional medicine, integrative medicine that are doing really cool stuff. And so I think we are absolutely all committed to constantly learning and kind of molding our approach to that to each patient.
Cool.
Yeah.
Yeah, and to add to that, I would say also to the patient that wants to stay healthy,
Yeah.
like so someone that's just like really eager to, you know, what I'm my protocol, is it correct? Is it benefiting me? Because we do know, like you were talking about earlier, epigenetics, we know so much now and we can really see, am I going down the right path? I want to stay this way. I want to feel great forever.
Cool. Yeah, it's awesome. Well, thank you guys for coming in,
Thank you. Thank you for
sharing
Having
me.
us.
through your busy schedules and stuff and sharing insights. That's always super cool. And if you have any questions, don't hesitate to reach out. We're always love to have conversations and at least point you in the right direction. We're always open to questions, comments, concerns, and conflicting opinions. If you have any thoughts on the podcast or anything like that. And if you want to reach out to us, the best way is probably our phone number, 561-899-8725. And I think we could probably have another podcast on like other things too,
Oh, yeah.
You could, exactly.
Yeah.
So we'll have to link up. So we'll catch y'all next time.